So here's the problem that I see with healthcare. If we put up a system that was like an NHS, National Health Service, let's say that there's that option. There's a few different ways you can go with a national healthcare system, but let's say we did that. One of the problems is there's a lot of things that the rich and the powerful would like to see, and they could push it through a national healthcare system. It could become a tool. They tend to weaponize the government. Uh, so they would weaponize this. For instance, in Iceland right now, they've eliminated Down syndrome. Well, they eliminated Down syndrome by aborting every Down syndrome child. Same thing with old people. They've got countries off in Europe, especially in Scandinavian countries, where they're, killing off their old people. They're killing off the mentally ill. They're killing off, in one case, that I remember, more than one, I'm sure, people that are depressed. It's just like we can make a perfect society if we just kill everybody that's inconvenient. The other thing is, people have talked about Medicare for all, and I've had the chance to observe Medicare for a while because my mother-in-law is 94. She's been on it for a while. And the way that she's done it is she's using one of these policies. I don't want to give a vendor name because it looks like I'm endorsing them, but she's got a vendor. I think they're pretty good. And really, it's been simple for her, and it's cut her costs quite a bit. And they just take care of it. They accept, as long as you pay for Medicare, they get the money from Medicare, and they take care of her needs. And it's very comparable to the private insurance I've had before, because I've used the same one actually. For our personal health care, when some of the time the consulting work I do it through my own corporation. I don't have employees other than myself, and my wife actually does the bookkeeping, so she is on there. But when I've had a corporation before, which I don't right now, I would pay for the healthcare out of that, and I would just get a private policy. Other times, I'm doing work through a vendor and working on their behalf, and when I do that, I'm getting healthcare through them, and those are good systems. And what she had on her through her Medicare doing it this way was very comparable. Just her out of pocket was really low. It was really, really well managed. So here's the thing. If we could figure out a way that all of us could chip in to make that work, it would be great. Now, there's so much waste in the government. I can't think that we couldn't eliminate the waste and end up with a net zero change in taxes. I'd like to think so. But this really needs some study. And it's right now, all of that study is driven by ideology and party politics and who the donors are and who wants to make money and all that kind of stuff. And that's just a really, really bad situation. We're so blinded by all these donations and all this money that we can't even see straight. That we can't even see the solution. So I do think there's something that could be done there, but we're going to have to be very careful that we don't end up giving the government power over us, but rather that collectively, cooperatively, we find a way to meet our health needs better, and especially to ensure the most vulnerable get what they need. And I believe there is a solution, but I'm not going to settle for something that's a halfway job. It's got to be done right if we're going to do it. And until then, we shouldn't be doing anything until we get it, until we know that we've got it right. So, sorry, this is a little bit waffly, but it's an awfully hard question. But I can tell you that I'm definitely not in favor of an NHS like the United Kingdom has, because I just don't trust it. But I think that we can come up with something that's a lot better. And I think, at least in some respect, there's something about the Medicare system when it's administered by these companies that are used to doing healthcare plans. I think there's a magical thing there. I think there's a way of doing that that's really good. And we just need to find the path to it. But we won't find that path as long as we have money in politics, because it's just people are going to do what makes money, and politicians are going to do what profits them, gives them more money and power. So I'm running without donations. I don't care about the power. And if you don't believe me, just watch. Put me in there. You can vote me out in 2 years if I go power mad. But I'm old, and I'm not likely to go power mad if I haven't done it already, because it actually revolts me. I don't know why. I just don't want to have power over other people. But that's another subject. Thank you. Oh, don't forget comments.